Hi, this is Dr. Michael DiMattina, Medical Director at Dominion Fertility. The question for you today is, why doesn't IVF always work? It should, right? We put the embryo in, where's the baby? Well, I've been involved in this since the early 80s. In 1982, the first IVF baby in the United States occurred, and I've been doing IVF since 1984. And I trained in England, where it all started, and then mostly in the United States, the NIH and locally. So I've been doing IVF for a long time. Back in those days, if you had a 10% pregnancy rate, you walked on water in the 80s and early 90s. Now, our pregnancy rates routinely run over 50% per transfer of a single embryo. Why? Well, back in those days, you didn't have an iPhone, did you? No, I didn't. Probably didn't even have a laptop in those days. No, I didn't either. And so things have progressed tremendously in the technologies and our knowledge too, so that now the pregnancy rates have tremendously advanced. But why is it still not 100%? We put the embryo in, we've got all this knowledge, we've got all this technology, where's the pregnancy? What's going wrong? And the other thing I should tell you is this, is that, you know, it's interesting, human reproduction is extraordinarily inefficient. So if you take the average 25-year-old couple in the United States who are healthy and they're trying to have a baby, most of them will get pregnant. But per month, the most healthy 25-year-old couple only has a 20-22% chance of getting pregnant per month. Over 12 months, about an 80% chance. It's not 100%, is it? What I'm trying to say is that human infertility is common and human reproduction is not very efficient. We make it more efficient when we do our treatments, particularly IVF, when we get eggs and fertilize them, make embryos. Now we test the embryos. We test routinely all of our embryos at Dominion Fertility using pre-implantation genetic testing with a 99% assurance that the embryo is genetically normal before we put the embryo in. Last month, I had an 80% pregnancy rate per transfer of a single embryo, my best ever. Usually it's around 65 to 70%. We couldn't get those pregnancy rates back in the 80s or 90s. Look where we are now. So whereas it's not 100% today, we're moving in that direction. Brighter days hopefully are ahead for all of us. Dr. DiMattina at Dominion Fertility.
Dominion Fertility, making miracles happen, one family at a time.